Hey everybody, it's Dr. Ashley, pediatric emergency mom. Happy Friday. So there's been quite a bit of in the news about different viruses, and so I was going to talk about those today. One that's been pretty heavy in the news is norovirus, and so for the past couple of weeks, we've seen, or you've probably seen headlines: norovirus cases surging, many cases of norovirus. And, when we see these headlines, I can definitely see how people would get very worried. What is this virus? Is this a new virus I have to worry about? And I wanted to do this to kind of put your mind to ease, I hope. Norovirus has been around for ages, ages. Norovirus is the official name for it, but what we call it is often the stomach bug or the stomach flu or gastroenteritis. So this virus causes vomiting and diarrhea, and maybe can also cause some muscle aches and fever. It usually lasts about 1 to 3 days, and is spread by the fecal oral route, which is kind of gross to talk about. But this is when you touch something that's contaminated, and then you put your hands to your mouth or grab something to eat and eat it, and then you're contaminated, right? And so the number one way to stop transmission is hand washing. It's just good hand washing. Alcohol-based hand sanitizers actually don't do anything for norovirus. So we really do need to wash our hands. And it typically peaks, it fluxes throughout the year. We are seeing more cases now. But I mean, if you think about it, there are always cases of the stomach bug, right? And we'll just see kind of like a roller coaster. We'll see peaks and valleys where we have lots of cases and then we don't see it much anymore. And I'll tell y'all, just anecdotally, last year, I think around Thanksgiving, we had lots of cases as well. But last year, it was more of a combination of rotavirus and norovirus. And at that time, it was lasting a lot longer. So what we're seeing now is 1 to 3 days of symptoms, so vomiting and diarrhea, plus minus fever. Now, the important things to do, obviously, washing hands, but should you get symptoms, the most important thing is to stay hydrated. So if you're not wanting to eat, or if your kid is not wanting to eat as much, that's okay, as long as they're drinking and able to keep things down. So this is definitely a case where I would contact your regular doctor. They might want to see them in the office, or they may be able to do a video visit. Certain medications like Zofran or ondansetron are great for vomiting. And that might help you to keep things down, or help your child to keep things down and stay hydrated to get past this. I tell parents all the time, what I worry about more is honestly the diarrhea. You lose a lot more fluids and electrolytes through diarrhea. So if your child's not able to drink, they're having profuse diarrhea, certainly looking lethargic or sleepy, just get them in to be evaluated. So long story short, norovirus is nothing new. It's something we have seen for ages. It's just that you may have heard it as stomach bug or stomach flu, and now you know the name of it, norovirus. All right, have a great day.